This week's muscle breakdown, I'm covering the most common area where the sciatic nerve can get entrapped deep in the muscles in the hip. Surprise alert, it's not the piriformis muscle. Hello everybody, Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists on the verge of burnout a new method that allows them to cut their treatment times by 50%, all while easily doubling their income. No gimmicks, just results. So back at it for my favorite segment, muscle breakdown. And I talked about this a few weeks ago about nerve entrapments. I talk about nerve entrapments all the time. Basically, nerves have 256 different areas in the body where they can get caught, and they have to go a long way. And one of the most common nerves that get entrapped in the human body is the sciatic nerve, especially in the muscles deep in the hip, because we spend way too much of our time sitting on our butts and not moving how we should. Now, when there's a nerve entrapment that's happening, it causes 4 big problems. It causes numbness, aching, burning, and tension. And a lot of things that are happening, especially unresolved low back pain, tightness in the hamstring, all sorts of things like sciatica, is actually caused by a nerve entrapment deep in the hip. Now, a lot of people think it's piriformis syndrome. Now, just a little side note on piriformis syndrome, and I talk about this all the time. Any diagnosis that has syndrome in it is just keyword for nobody has a damn clue about what's going on. And anytime you hear syndrome, it just isn't really telling this. So we really default a lot in musculoskeletal world of like, oh, it hurts back behind the hip, it's got to be this. And we try to put everything into like a junk box diagnosis. And I always say you have to have a tissue-specific problem about what's going on. And actually, the area where that sciatic nerve is going to get caught is really deep in the external rotators, specifically the superior gemellus. It has like 80% of its contact there. So 5% of the time, yeah, it's piriformis, but 80% of the time, it's actually superior gemellus and some of those deeper rotators, and then the hamstring as well. So what I want to include in this week's breakdown, I'm going to make this into 2 parts. This week, what I want to do is show a functional evaluation that we do to see if that sciatic nerve is getting entrapped in the deep rotators, if it's causing problems in the low back, or if it's getting caught in the hamstring. Then I'm going to give a very detailed palpation of the external rotator so you can really see where that sciatic nerve is getting caught. Because over time, what happens is that scar tissue forms and it gets stuck to the nerve. And when it gets stuck, it causes all those problems: pain, weakness, decreased flexibility, numbness, and tingling. So I want to show you how to know you have it and then palpate it correctly. So I'm going to drop those videos in right now. So this test is going to be the hamstring functional test, and I'm going to take you through the full test for that. So client's going to be laying down on the table, nice and neutral here, legs straight, and the first thing you're going to do is just kind of get an idea of the overall range of how things are going. So what I like to do first is kind of kneel down, and I'll hold on the top here right above the knee, and I'll get a little bit of extension there. That'll allow it to lock in place. And the first step you're going to do is you're just going to lift that leg up nice and easy. And you'll kind of get a feel for what that's like. It might give you a lot of resistance, especially if there's a lot of dysfunction in the hamstring, or there's an entrapment of the sciatic nerve, or even a disc problem in the low back. So kind of get an idea of what that feels like and where that end range is. So once you do that, then you're going to lift that up, and then I want you to kneel down on the table and let that back of the Achilles rest right here. And then you're going to go just above the knee and pull in a little bit and lock down. And then I want you to stand up in through that motion. And what you're going to feel is how much resistance you're getting back from behind the heel. That's going to let you know where that limit is. And you're going to ask the client, where do they feel the discomfort? So you want symptom location. What does that feel like? And how intense? So you're going to get all of that data and get a better idea of what's going on. And you want to watch this other leg as well. You want to make sure that stays on the table. A lot of times they'll go here and then they get some extra range of motion and some more movement that can alter that test. So once you've collected all that data, now what you want to do is see if it's actually coming from the sciatic nerve or if it's coming from the hamstring. So the last part of that test is you're going to go through here, and you're going to get to that end range, and once you're there and you feel that resistance, you are going to pull down very gently on the bottom of the foot, and you're going to ask the client if that increases that symptom or changes it. And a lot of times when that does that, it gets very positive for an entrapment of the sciatic nerve, usually at the superior gemellus or at the hamstring. And essentially, if you do this and it doesn't change it, and then you do this and it actually makes it better, then we know that it's coming from somewhere in the actual hamstring itself. This test is very positive when there is a sciatic nerve involvement in there. And like we said, normal range should be right up here to 90, with the other hip down on the ground. So now we're going to check the two areas where it's most common for that to get caught up. So lay down on your side. Scoot down here. I'm going to get you over here. So first area where it gets caught up in that sciatic nerve where it goes through is down right against the superior gemellus. You know, a lot of people think it's piriformis, they think it's something else, or the glute. It's not. That sciatic nerve is in full contact with that superior gemellus, and it's a perfect point where people sit so that nerve can get stuck there, and that can create a limited test, can create pain down the leg, tight hamstrings, everything like that. So what I like to do is I like to palpate it with just a little bit of relaxed in there. And this one, you got to use your landmarks to find it. One place we go first is greater trochanter, and we can find that. Anyone can find that. And then we come off to the side here, and this is the back part of the trochanter. Next thing I'm going to do is I'm going to pick up my thumb and fall into that space, and you can see how I can really sink in on that. This is getting on those external rotators. I'll spin my thumb around just a little bit, like that, and now I want to see how that nerve is bowing and how it's moving. When the nerve is stuck, it won't bow. So what I'm able to do is sink in, and then the sciatic nerve is actually running right through here, so I'll go in there and I'll see how it's moving. And that one's pretty good. I'll pick my thumb up, go here, and that's where it starts to get jammed up a little bit more. Pick it up again, and right there is where it's really jammed up. And that's right on that superior gemellus, right where those external rotators are. And that nerve gets caught here. So a lot of people with tight hamstrings, pain in the calf, even numbness or tingling, a lot of times it's coming from here, and all the tension is in here, and it's not allowing that nerve to slacken. This is about 80% of where entrapments occur in the external rotators in the hip, especially with sciatica-like symptoms. One of the key tenets of my method, the PEAK method, is getting to a tissue-specific problem and knowing exactly where that problem is, because how in the hell can you fix a problem if you don't know what it is in the first place? And so many people are treating the piriformis and not even knowing if that's the true cause of what's going on. And it's like, you can't fix a problem if you don't know what it is in the first place. So what you see in the PEAK method is we really dive in and know exactly where the problem is so we can go in and actually fix it. So if you like the video, give it a comment, a like, or share. We do have free training in my system, and you can learn more about what we do. In the free training, we actually show more palpation of the sciatic nerve and even show you how to treat. I'm going to show that in the video next week, but go grab that free training. I'm not trying to sell you anything. I just want to help you become a better version of yourself so you can help more people. Get the link below, and I'll see you guys on the next one. Bye.